Okay, so I'm going to be hosting this panel discussion. I'm sure all of you would realize that they have just given very radical presentations on liberating healthcare markets. So I'm just going to ask them some very, very difficult questions. I hope that all of you will also join me in challenging them. So first, let me just interrogate Dr. Carl Varner a little bit further. So 3 questions for you. Okay, so first, the problem of big pharmaceutical companies. So just a few years ago, perhaps you guys would have seen in the newspaper, we have this person, Martin Shkreli, who is a former American businessman and hedge fund manager, and he was widely criticized when his company obtained a manufacturing license for the antiparasitic drug Daraprim and raised its price by a factor of 56, leading him to be called the most hated man in America. And this is related to a second question that I have. If you want to liberate healthcare markets, you are saying that healthcare should be a commodity and not a human right. If that's the case, we need to know that markets allocate resources based on the ability to pay. So for people who have less dollars and less money in their pockets, are you saying that these people should have less healthcare? Less healthcare and less quality healthcare, because people who are richer obviously will have more and better healthcare. And the third related point is about regulation of unsafe products and unsafe, medical professionals, right? So we understand your point that we need disruptors to break the rules, we need to deregulate, but we have clear cases where we have unlicensed medical professionals, in simple terms, quack doctors, right? So there is a case right in front of me right now on my iPad. This person performed a botched genital enhancement therapy that left a man with a 1-inch non-functioning organ. How do you deal with these problems in your system?
Well, let me first start by, let's see. Okay. All right, well, let me first start by addressing Martin Shkreli and Daraprim, because this is an important point. And that is that what Martin Shkreli did was bought a government monopoly. Daraprim is not a drug that is subject to a patent. Its patent expired in, as I recall, the late 1960s. Yet there is only one license to produce the drug in the United States as an artifact of various medical laws. So he purchased a government monopoly and then he proceeded to exploit it. And the reality is that government allowed him to do that. Now, if you go to India, where they have a very burgeoning generic pharmaceutical market, Daraprim costs 5 cents a pill versus $750 a pill in the United States. This is so this leads us to the second question. You say the poor people have trouble obtaining access to healthcare. Well, at $750 a pill, even rich people have trouble obtaining access to healthcare. But when you have a free, functioning, competitive market, because in India multiple drug makers make Daraprim, you don't have this problem because prices tend in a free and competitive market to trend towards the cost of production. The crazy, outrageous prices you see in a lot of developed economies are the result of regulatory capture and cartel systems and exploitation of government markets. So your next question about how I can guarantee quality of physicians in a free market system. Well, the answer is I can't guarantee anything because the only guarantee in life is death and taxes. But what I can tell you is that government is a very, very poor judge of quality of a medical practitioner, at least in the United States. And the reason is this. When you allow a system to become subject to a regulatory capture and cartel, as has happened in the United States, and I can't speak to what's happened in Singapore because I'm not an expert about Singapore healthcare, but in the United States, we have a licensure regime that is very draconian, and in practice it means that there is actually a physician supply that is capped by the government. So we have a serious shortage of physicians, and what I observe in the hospital over and over is extremely bad behavior by doctors, shoddy work, laziness that is never disciplined. It is not disciplined because the hospitals are in such a difficult position to hire doctors that you can get away with anything. You're the talent, you're the celebrity. I have hospitals fly me across the United States just to work 1 or 2 days in their hospital because they would have to shut down otherwise. The scarcity is so bad that you can't ensure quality. So if the idea is that we would have a licensure regime to ensure quality, well, I'm sorry to tell you, At least in the United States, the licensure regime has diminished quality, not improved it. The fact of the matter is, when licensure was created in the United States, it was created by physicians who were killing their patients. I mean that in the 1850s, bloodletting, mercury poisoning, and skin blistering were common medical practices. And the doctors who were being derided as quacks were people called homeopaths and eclectics who were doing things like giving patients steam bath and herbs. Now, I would rather receive a steam bath and some herbs than I would receive a bloodletting, but the government actually took the side of the bloodletters to try to drive the eclectics out of practice.
So with these problems of medical licensure, wouldn't the argument be to improve and reform the existing system rather than to get rid of all licenses altogether? We see many occupations, with basic licenses, like, if you want to be a taxi cab driver, you need a license, right? You wouldn't want someone who doesn't know how to drive, right, to just drive the car, for you, right? So isn't this the same thing for medical?
Well, it's a game theory problem, and the game theory is this. There's a concentrated benefit and a distributed cost. Okay, so the concentrated benefit lies to the people who have the license. I receive a tremendous benefit from medical licensure. I receive a tremendous financial benefit. All of my patients lose a couple of bucks. So the public doesn't have the ability to lobby for something that will affect the public in the same way that the concentrated industry has. And so what you have is the industry regulating itself to the benefit of the industry. And I'm sorry to tell you, the only solution to this problem is to do away with the government's power to regulate industry. You will never ever, this is a progressive fantasy, that you will create a benevolent regulatory regime that benefits the public. That is not how it works because of game theory. Regulatory regimes will always work to the detriment of the public and the benefit of the industry.
Yes, please go ahead.
Yes, okay, I'd like to comment on that point too, especially you made the parallel to the taxi drivers and their licenses. We know that most all occupations seek guilds to keep out their competition. As the taxi drivers in New York City said, well, we have to be licensed, and so they didn't allow any more licenses, any more cabs to be owned in there than over the last 70 years. The result has been that the price of a medallion now is over $1 million. So you have to pay that much to get into the cab business, just to drive around and to service people. So it wasn't for the protection of the public, that was the facade, but the real reason was to give a protected market to the taxi license. And the same in the medical profession, as he pointed out, the history of that. It keeps medical profession extremely expensive. And what is the alternative to a government monopoly that's very expensive? Self-treatment. And that's not so good either. So I much prefer a certification process. Allow any, challengers to the American Medical Association to come into the world and offer certification of a philosophy of medicine or practitioners of medicine. And in TripAdvisor and Consumer Reports will do evaluations from third parties independently of what the quality of the care. So you get lower prices, much more quality, much more innovation by that competition between competing certification organizations rather than all just one government monopoly.
So I think you are referring to the possibility of the market providing certification services rather than just relying on a public certification body which has a monopolistic power, right? Okay, so I just want to press you a little bit on your speech on organ trading. So you gave a very economics-based explanation on why there's a shortage and why if we liberate, organ trading and we can help many people gain access to these very much needed organs. But I think I'm sure many of you amongst the audience and most people in society, they have some moral concerns about putting a price on the human body, right? So they may accept your economics, they may accept this on an intellectual level, but there is something about just putting a price on the human body, the kidney, and treating it like a piece of meat, let's say, right, to be bought and sold in the butcher shop, right? So how do you address this moral concern?
Okay, let me first address the overall assumption that the government is more moral and wiser with people's lives than the rest of people in society. The government that bombs and kills people around the world, that has had nuclear exposure of radiation to people endless times without a single person being held accountable, without a single person going to court for all of that. We have to keep in mind the guys in government are the people we don't believe in their promises when they're running for office. We don't believe they're ethical. Why would we believe that when we get a whole bunch of them together into a hall together, they might come up with something more moral than we have? Now your question was, isn't it rather immoral to be trading a body part for money? I was thinking about that. My school pays me money for my whole body. I mean, isn't that immoral? I mean, to sell my body, I'm sort of selling myself into slavery, the whole thing. Now, if I wanted to take a part, actually to save somebody else's life, you know, a kidney, I mean, that should be considered to be a great, noble achievement, but instead, that's considered to be, you have to give it to them. You can't take into consideration the cost to me of lost work, of the suffering, of the pain. I have to give well, I don't expect to have to give my whole life to everybody else. I expect to be paid for it, just as I would expect to be paid for.
But I guess, you know, there's a deeper issue beyond that, right? So I guess the question is, are markets in apples and oranges, let's say, just the same as markets for sex, markets for human body parts? Because we see in certain markets there's special characteristics there that don't exist in, you know, like supermarkets, right? So when we talk about human organ trading and sales, a lot of these activities take place in very poor, developing countries where people are exploited. These are amongst the most vulnerable people. So certain markets have special characteristics, and you know, it seems unfair for you to just compare this with, you know, you being a professor or you selling your educational services.
Well, you're absolutely right. I looked around at some of the skyscrapers here in Singapore, and I noticed that there were some people outside washing windows, and they're very risky, dangerous jobs. I'm guessing that they're not taken; those jobs aren't taken by the wealthiest people in Singapore. They're taken by people with less income, less skills, and those are the jobs that they can get. Now, whose decision is it? Is it their decision about whether to take a dangerous and risky job? Or is it my decision? Should I presume that I know better than they do about what kind of work they can do and for who they should pay and what they should be paid and all that? Frankly, I think it's very presumptuous. It's the idea of eminent domain. If I make the decisions for them and don't allow them to make the decisions for themselves, then I'm presuming to be their superior owner.
But I guess there's some very clear-cut cases, right, which are reported in the news whereby, you know, some of these organ donors, they don't even know that they have two kidneys, right? They don't even know they have two kidneys. So there are some very clear-cut cases whereby we definitely know in this clear case that, you know, it's wrong. Right, and they shouldn't be exploited. So, are you exaggerating the problem?
The senators who passed this legislation don't even know that they're killed 150,000 people. I consider them murderers by preventing people from saving their lives. And they don't know that. How do we expect those guys who are senators to know any better than you about your own body?
Also, I would simply point out that the exploitation you're referring to is a direct result of the legislation because it pushed this into the shadows. It created the black markets. And then to point out that there is exploitative behavior occurring in the black market is not very profound. It's simply what's going to happen. So why don't we try to get rid of the black markets? But the other thing I would point out, what Al Gore, who is the global warming activist with the single largest carbon footprint, what Al Gore said when he passed this law was that this was to ensure equal access to organs for the poor. This was an egalitarian law. It was designed to, or the expressed intention behind it was to create more equality. Additionally, it was easy to predict this law would kill people. It should not surprise anyone. Set the price of organs at zero and people die. What it means is that progressives like Al Gore do not care if they kill each other, or if they kill people, if they kill innocent people, as long as they are promoting equality. Progressives are literally willing to kill for equality because that is their God and that is what they worship. And that's one of the reasons I consider progressivism to be one of the world's most evil ideologies.
Okay, so with that, let me put it another way. Okay, let me put
Is
it in
everybody
this other
awake?
way.
I don't want you to go
Yeah,
sleep
please,
on this.
please go on to the microphone stands and ask more questions. Right? Don't let them get away with these very radical proposals. Right? About selling your kidneys, selling your organs and body parts.
Yeah, quick.
Okay, so let me put it this way. Okay. So if you say you want to allow people to buy and sell kidneys, I guess the question is, where are we going to draw the line in terms of the place of money in society and how far we will extend the cash nexus in social relationships? Let me just read out two examples that have occurred, okay? In Tokyo, the public relations firm WIT Incorporated paid young women $121 a day to wear sticker advertisements on their thighs as they go about their days. The women must be young, popular, thin, and pretty. They agree to wear short skirts or shorts. And the CEO explains it's absolutely perfect to put an advertisement as that's where the guys will look at. Right? So that's the first example. I have one more. In the United States and elsewhere, one can purchase subscriptions to websites that collect nude or sexual pictures men have submitted of their ex-girlfriends. These pictures were meant to be private. The women intended only for their boyfriends to see them or their ex-boyfriends. Sometimes men submit these videos to exchange for some money in order to humiliate their exes. This is called revenge porn, right? So these two examples drive at a deeper point. How far are we going to allow money to corrupt social relationships? So it's not just about kidneys, it's about the way we understand the place of money in our society.
Okay, we can both address this, but I really do think that equality should be enforced in that first case. I think that the company should pay me to have one of those tattoos right here.
I'm not sure if they are going to pay much for
leg,
that.
I'll wear a short so that all the beautiful women can see that and get really turned on. Sorry, dear. But frankly, I mean, yes, I may object to things, but it's not my life. I mean, I don't want to do things with my body and with my life, but that's my life. For me to presume what is right for your life, I mean, I would keep people from scuba diving and skydiving. I don't like skydiving, and I don't like scuba diving anymore since it was very dangerous and risky. But who am I to say that another person shouldn't be allowed to do those things? I think that that's the difference between a free society and one that's where you don't own your life. You're the slaves of the state.
Well, I would say that the question was a very typical progressive type of question because it conflates victimless crimes with victimless acts with acts that do have a victim. So revenge porn has a victim, and it has a violation of an agreement that people had, at least an implicit, but sometimes a very explicit agreement that these photos would be private. Well, as somebody who is voluntarily agreeing to display advertisements on their thighs, I mean, well, good for them. I hope they get paid a lot. But this is what happens in political discourse with collectivists, is they know they can't win on the argument that the government or that the society should control other people. So they try to conflate an action that they don't like, people advertising things on their thighs, to an action that is genuinely immoral and should be stopped, that is the violation of other people's rights. And so we have to separate those two. The first is voluntary, the second is a combination of fraud and coercion.
So should everything be for sale? No limits?
Everything that is voluntary, I mean, when you ask the limits, what does that mean? It means somebody coming and external to me saying, you may or may not do this, that, or the other thing. And so I guess I would just quote, I don't remember who said it, but my right to swing ends where your nose begins. So yeah, there should be no limits when there's no victim. No victim, no crime. If I could put a hashtag there. Hashtag no victim, no crime.
Yes, Ken.
Remember how many years, I won't speak about Singapore, but in my country, the United States government drafted, that means enslaved young men, to go fight off in wars to kill or be killed that were senseless wars, wars that they didn't even believe should have been fought in Vietnam and many times where people were being forced to do these things. Now, I'd say for a government to do that sort of thing and then to say what I can do with my life is pretty absurd. And look at what happens in a society where you ban things. When you prohibit prostitution, for example, it goes underground. It becomes the prerogative of the pimps and the black market and the gangs. The women are treated very, very badly in the black market. Prohibiting something doesn't make it go away. It just puts it into the hands of people or criminals.
Okay, so I think we just have time for one audience question. Is there one or two? Yeah, you can go ahead there, yeah.
Just on the topic of Martin Shkreli, I know he invented one of the first drugs for pecan disease, but back to the toxoplasmosis, the Daraprim?
Yeah.
He claimed, I don't know how true it is, but let's just assume it is true, he said that he would give the drug away legally, not for free, but for a couple of dollars to those who genuinely needed it and reached out, but it was the insurance companies who he would, make fit the bill for the price. If that's true, and I don't know if it is or isn't, is that still a huge burden on the healthcare system? Or when you consider other huge pharma like Pfizer and the price of some of their drugs, is Daraprim going to have much of an effect? Or?
Yeah. Well, yeah, what's interesting is that strategy right there is, Professor Schoolland could probably speak more to this, but it's about segmenting your market. It's about making the people who can pay more, and then the people who pay less, and you get as much as you can out of each individual sector of your market. And pharmaceutical companies do this by lobbying governments to prevent people from bringing drugs across borders. So is it a burden on the healthcare system? Well, in the United States, we spend almost $10,000 per person per year on healthcare. It's absolutely crazy. So, Daraprim's a really niche drug. You're not going to break the system with one drug, but this kind of thing happens over and over and over again. We wouldn't have drugs that cost $5,000 a month left and right if we didn't have a third-party payer and system. Because individuals are just they're not going to buy it. Yeah. So the only way we see such crazy prices is through insurance companies.
So, without further ado, maybe I'll just get the both of you to, have your concluding statements about how do you envision the future of healthcare and the role of government in healthcare. Just maybe 10 seconds each, and we'll conclude.
All right, well, I say the future of healthcare belongs to the rule breakers, and it belongs to the iconoclasts, and it will happen outside the borders of the United States.
I think our healthcare is our greatest concern, and for my family, and so it should be our decision about where to buy things, how to buy things, from whom to buy things, and for the producers to seek that out. But for the government, who almost nobody trusts, the politicians who most people find are dishonest and dishonorable to be standing in between me and my own healthcare, I think that's been proven how catastrophic it's been in the case of organ donations, where Senator Al Gore is so revered, just like King Kamehameha, so revered despite the carnage that they've caused.
Thank you, Dr. Schoolland and Dr. Varner. Let's give them a round of applause. Thank you.